USDA logo, United States Department of Agriculture.
Forms. Today's event, Birth and Beyond, Advancing Equity, Nutrition, and Food Security, is organized by the National Agricultural Library's Nutrition and Food Safety teams and has the support of our Agricultural Law Information Partnership. The partnership represents a collaboration between the National Agricultural Library, the National Agricultural Law Center, and the Center for Agriculture and Food Systems at the Vermont Law School. The Agricultural Law Information Partnership connects consumers, producers, and legal professionals with the agricultural and food law information they need to support and ensure the success of all forms of American agriculture. Food and nutrition are separate concepts that converge at the point of access. Food should be not only reliably available to everyone, but also affordable, culturally relevant, and nutritious. Today's event will focus on food and nutrition equity, the role of nutritional guidelines, and the policies and programs the federal government and non-governmental organizations are implementing to equitably improve food and nutrition security in the United States. According to the USDA, more than 38 million people, including 12 million children, are food insecure in the United States. Hunger and food insecurity disproportionately affect people of color. 10% of white households in the US report food insecurity. Over 20% of African American or Black households and 19% of Latinx households experience food insecurity. And Indigenous Americans face food insecurity at almost twice the national average. Advancing equity, nutrition, and food security are strategic priorities for the USDA and for our nation. To support our program today, first, we will hear from keynote speaker, Dr. Maya Barato, Vice President of Federal, State, and Municipal Partnerships at the Partnership for a Healthier America. Dr. Maroto will speak about the convergence of food and nutrition security, the role of nutritional guidelines, and the policies and programs the federal government and non-governmental organizations are implementing to equitably improve food and nutrition security in the US. Following Dr. Maroto, Dr. Tanya Eggers-Collins will speak. She is a program director in the Health Behaviors Research Branch of the National Cancer Institute. Dr. Eggers-Collins will present the National Institutes of Health's Nutrition and Health Disparities Framework, which focuses on addressing the causes of nutrition health disparities with a particular emphasis on nutrition at different life stages and focusing on equity and cultural diversity. Following a short question and answer session, for Dr. Maroto and Dr. Eggers-Collins, we will hear from the USDA's Dr. Sarah Bleis. Dr. Bleis was recently named Director of Nutrition Security and Health Equity for the USDA's Food and Nutrition Service. She will give an overview of USDA Secretary Vilsack's goals around nutrition security. I will also note that Dr. Bleis will also speak in an upcoming NAL event entitled Nutrition Security Definitions and Discussions on May 10th at 1 p.m. Please see the chat for registration information and check out our social media channels for more information as we get closer to that May 10th event. Our final speaker today is Leilani Nelson, Associate Director of the Center for Agriculture and Food Systems at the Vermont Law School, one of our Ag Law information partners. She will highlight the center's Healthy Food Policy Project and the resources available to help create more equitable local food and nutrition programs and policies. I would now like to say a few words on the value of the afternoon editing session that we're going to have following this morning's presentations. As it may be obvious to all of you, Wikipedia is where the world goes first to introduce themselves to information. Wikipedia is among the top 10 internet sites visited daily. Around the world, Wikipedia is accessed by over 1 billion unique visitors each month. To make this resource work, Wikipedia relies on volunteer editors and programs like this edit-a-thon to create reliable information, improve existing articles and related content, and reliably fill gaps in basic knowledge. Over the past 3 years, the National Agricultural Library has hosted edit-a-thons related to agricultural history, USDA Women in Science, the Food Safety Modernization Act, heirs property rights, equity and social justice in food systems, and much more. Anyone interested in editing verifiable nutrition security information to Wikipedia from USDA and other credible resources, please return today at noon for the edit-a-thon portion of the program. There'll be a short training session conducted by Jamie Flood, who you heard from earlier, who is our Wikipedian in residence for new or inexperienced editors, and then we will edit as a group until 3 p.m. this afternoon. I'll also note that while we hope you'll join us for the full day, please feel free to come and go as you can. So to recap our agenda process for this morning, following our first two speakers, we'll have a short question and answer session. And then as we proceed, please put your questions into the chat at any time, and they will be compiled during the presentation, and I'll read them for the speakers. After our second two speakers, we will have a second question and answer session during the last 10 minutes of the program, wrapping up at around 11:30. And there may be a little bit of variability with that as well. So without any further ado, I welcome Dr. Maya Maroto, Vice President of Federal, State, and Municipal Partnerships at the Partnership for a Healthier America. Dr. Maroto, the floor is yours.
Thank you. Thank you, Paul, for that introduction. And thank you to everyone at the National Ag Library and at Ag Law for pulling together this event and for inviting me to speak. I also want to just acknowledge, I see so many familiar names in the attendee list. So hello to all of my friends and former coworkers or current coworkers and even family. So it's great to see so many familiar names. And I really appreciate everyone taking some time out of their schedule to attend this event to consider some of the issues around food and nutrition security. So again, my name is Maya Maroto, and I'm Vice President of Federal, State, and Municipal Partnerships at the Partnership for a Healthier America. And actually, just last night, I was listening to some clips from Judge Ketanji Brown Jackson's confirmation hearing. And she was talking to Senator Cory Booker, and her quote that she said was, "I struggled, like so many working moms, to juggle motherhood and career." And that statement really resonated with me because as a working mom myself, I've often felt the same way. And I know that this is just, one of many challenges that face American parents and caregivers is around the feeding of children and the struggle to juggle the demands of life while also doing a good job with all the meals and snacks, which seem to be never ending. And this is part of the topic that we will discuss today. So today we're focused on nutrition for children from birth to age 2. This is a new topic in the dietary guidelines for Americans, and it's such an important topic because we know that the start of a child's life is so important for setting up their trajectory for mental, physical, psychological, and even emotional health for years and decades to come. So for me, on a professional level, as a registered dietitian and public health practitioner, and also on a personal level as a Black woman and mother, I'm deeply concerned about the inequities that persist around the nourishment of babies and toddlers. In 2008, The Lancet established the first 1,000 days. And if you're not familiar, that's the period from conception to age 2 as a critical window with dramatic impacts on children's ability to reach their full potential. The first 2 years sets the stage for how likely you are to die prematurely, develop chronic disease, develop your brain fully and have full cognitive function, and even whether you have the capacity to work and function in society. So this is a period of rapid growth and development where the nutrients that a child encounters are so important to ensuring that that development happens properly, and where any deficits that are encountered can be either difficult or impossible sometimes to overcome. And what we'll see when we talk through this today is that the disparities that exist fall very neatly along lines associated with inequality in our society, with Black, Indigenous, and Hispanic Americans, people in rural communities, people with disabilities, and other under-resourced and historically marginalized groups experiencing the worst outcomes. And this is due to both the structural and social determinants of health. And this is one of the reasons I decided to join the Partnership for a Healthier America to work toward the pursuit of food equity, which we know is the key component to the ultimate goal of achieving health equity in our society. Next slide, please. So I don't know if you can you advance the slide for me, Jamie? Thank you.
I'm sorry, having a technical difficulty.
No problem. So here's our objectives for today's session. So hopefully by the end of this session, you'll know a little bit more about the work and vision of the Partnership for a Healthier America. We'll also talk through some key definitions that I think are foundational to conversations around disparities and equity and nutrition and food security. I'll also go through the dietary guidelines for Americans, those new guidelines for birth to age 2, and talk about how we're doing and what are some of the areas for improvement in those guidelines. And then lastly, I'll talk through the pillars to food equity and how you can support food equity. Next slide. So on the next slide, you can actually move it again. So our mission at the Partnership for a Healthier America is to transform the food landscape in pursuit of food equity. We believe that every family in America and every zip code across this country should have access to good food. What does that mean? That means food that's healthy, sustainable, high quality, and it's desired by the people who are eating it. It's culturally connected and culturally relevant. So our work helps families access affordable, healthy food. Next slide. PHA was founded in 2010 to build on former First Lady Michelle Obama's Let's Move initiative. And our work started out in the private sector, leveraging the power of food companies to transform the food landscape. But when COVID-19 made the impacts of our unequal food system on the health of under-resourced communities so abundantly clear, PHA's mission evolved to the pursuit of food equity. Next slide. So PHA does our work with many, many partnerships. So we work to develop evidence-based approaches implemented in partnership with food industry, with government, with the retail sector, and other community organizations like food banks to accelerate the pace of transformation toward a more equitable food system. Next slide. So a few key definitions that I wanted to talk through, so you can move along to the next slide. This graphic was produced by the Robert Wood Johnson Foundation to highlight the difference between equality and equity. So thinking that the same approach will work universally is like expecting everyone to be able to ride the same bike. And as you see in that top picture, the bike is too big for some people, it's too small for some people, it's not usable by some people. Equity is not the same as equality. So in order to equalize opportunities, those with worse health or fewer resources will need more efforts and tailored supports to improve their health. So health equity means that everyone has a fair and just opportunity to be as healthy as possible. So everyone in the bottom picture has an opportunity to ride down the road. This means removing obstacles like poverty, racism, discrimination, and their consequences like lack of access to good, healthy food, jobs with fair pay, quality education and housing and safe neighborhoods, and healthcare. Next slide. So I wanted to talk about the difference between disparities and inequities and also talk about food security versus nutrition security. So health disparities, a disparity is just a difference. And a health disparity is a difference in health status and mortality across different groups. And some of those can be expected, like there's a disparity in cancer rates between the elderly and children. And inequity is a difference or a disparity that is avoidable and systemic and unfair. So an example of a health inequity is the breast cancer mortality rate difference between Black women and white women. That is not due to biological factors. That is actually systemic and that is actually unfair, and it's avoidable. Food security means having consistent access to food within the home. And as Paul kicked us off with the stats, we know that 38 million Americans are considered food insecure, and the rates are increasing dramatically during the pandemic. And as he pointed out, especially among communities of color. Nutrition security builds on food security, and it incorporates the idea of not only having access to food, but health promoting and health restoring foods. And you can actually move along to the next slide. So nutrition security, as you see, incorporates the idea of consistent access with quality food, as well as incorporating equity, because nutrition security, in its definition by USDA, focuses on achieving this among racial and ethnic minority populations, populations living under the poverty line, rural and remote populations. So food security is having enough calories, and nutrition security is having the right calories. Next slide. So I want to introduce a metaphor that was shared with me by one of my PHA coworkers that comes out of the Racial Equity Institute. So I want everyone to imagine that you have a lake in front of your house, and there's one fish floating in it, belly up, dead. It makes sense to analyze the fish, right? You say, what's wrong with this fish? So imagine this fish is a 12-year-old child who has obesity and type 2 diabetes. We would ask, what's going on with this child? What is this child eating and drinking, and what's in their home? And what resources and information do their parents have access to? And those are good and important questions, and questions that should be asked. But if you come out to the same lake and half the fish are floating belly up, dead, what should you do? So this time, you've got to maybe start analyzing the lake, right? So imagine that the lake is the food system, and half the children in it are overfed and undernourished. This time we might ask, how might this system be causing these consistent, unacceptable outcomes? What is going on here? Now, I want you to picture there are 5 different lakes around your house, and in every single one of these lakes, half the fish are floating belly up dead. What's the time to do now? It's time to analyze the groundwater, right? That's connecting all of these lakes, and say, how did the water in all these lakes end up with the same exact contamination? And that's what we see in this country. And no matter what city, state, municipality, from coast to coast, north to south, east to west, we see the same patterns of Black, Indigenous, Hispanic Americans, people in under-resourced communities falling out and not having good health outcomes. So what is connecting all of these areas and all of these patterns? What is the groundwater that's feeding into the lake? And these are the forces that created the 2-tiered food system that we're living in today. The structural determinants of our society and how we're living include racism, ableism, sexism, and other forms of marginalization and discrimination based on personal characteristics or even geography, like what we see in rural areas. These structural determinants feed into the social determinants of health, including food access, economic stability, neighborhood environment, healthcare access, and the social context in which people live. I want to make this clear. I am not making a value judgment about working at any of these levels. If you're a practitioner working one-on-one with clients, that's kind of the level of the fish, that is valuable and important work. We need people working at all of these levels. If you're working on systemic change in the food system, the level of the lake, that's valuable and important work too. And if you're working on factors beyond the food system, even that drive our underlying inequality, that is valuable and important work too. If we're going to tackle these issues, we need people working at all of these levels. Next slide. So PHA is doing a deep dive into the 2-tiered food system where people in under-resourced areas are not able to consistently access and consume nourishing foods. So we know that for too many Americans, healthy food is too far away, it's too expensive, it's too time-consuming to acquire, prepare, clean up from, or it's being drowned out by the marketing of unhealthy foods. So we're looking at the fish, the lake, and the groundwater that are feeding in to our current food system and to these inequities that we see today. Next slide. So I'm going to talk about the guidelines for birth to 24 months because, as I said, this is a new part of the dietary guidelines, and then talk about some of the literature around how we're doing with meeting the guidelines. And you can probably guess, we're not doing very well. So next slide. So we'll start with the youngest of this age group, so birth to 6 months. The primary preferred food source for the first 6 months is breast milk. And when breast milk is not available, iron fortified infant formula is recommended. Supplemental vitamin D is recommended. And around 6 months, this is when nutrient dense complementary foods, which is the government's way of saying healthy, whole, minimally processed or unprocessed foods, foods with one ingredient, hopefully, are being introduced to children's diets. So next slide. This is a figure from the Journal of the Academy of Nutrition and Dietetics in a recent study where they looked at the breastfeeding rates. And what you're seeing, the black line at the top is the goal. So the goal is that by the year 2030, 42% of infants will be breastfed exclusively for 6 months per the recommendation. And right now, the number is about 25% who are meeting this goal. But as you see from the lines underneath, Black and Hispanic infants are being breastfed exclusively at the lowest rates, where Asian and white infants are doing a little bit better in this area. So we're seeing that no one's quite meeting the recommendation, and there are inequities in terms of breastfeeding rates. So what happens if we look sort of behind the lines and the numbers at the actual people? What does this mean in terms of people's lives? This means that when children are not breastfed per the recommendation, they're more likely to die from sudden infant death syndrome. They're more likely to develop persistent, recurrent infectious diseases, to develop asthma, obesity, and type 2 diabetes in their childhood years. So I know that, when you think about these serious diseases, I know last time my son had seasonal allergies, it was nearly a national emergency. And thinking about the stress in the lives of families who are extremely resilient and who have a lot of resourcefulness, but get pushed to the limits by dealing with these serious issues. And we're talking about families who may not have access to a job that provides leave, may not have access even to health care, where a day missed from work could mean there is no job to come back to because you're fired. So these disparities exacerbate the enormous amount of stress that is on many families. And what's in the lake and the groundwater? So the American College of Obstetrics and Gynecology did a deep dive on this issue, and they talked about some of the factors like unequal access to paid maternity leave. We know that if you go back to work within 6 weeks of having a baby, you're 3 times more likely to stop breastfeeding before 6 months. There's also unequal access to baby-friendly hospitals, the hospitals that have all the supports needed to help moms and babies bond and start off their breastfeeding journey on the right foot. The article also talked about historical factors like predatory marketing of infant formulas to Black American families in the 1950s that is still playing into breastfeeding decisions made by Black American parents today. So these are some of the lake and groundwater issues around the breastfeeding rates that we see today. So let's look at what happens once foods are introduced. You can move to the next slide. So for children, once they do start eating, and that we'll focus on up to age 2, from 6 months to age 2, the recommendation is a variety of foods, so protein foods, vegetables, fruits, whole grains, dairy, especially foods high in iron and zinc. So those could be meat or seafood or fortified infant cereals. It's also important for children to avoid high sodium foods and to limit high sodium foods, I should say. So not zero, but limit, but avoid, meaning no foods with added sugars. And I'll distinguish for the non-nutrition folks who might be in the audience, this doesn't mean sugar from fruit. This means sugars that are added to different products like sugary cereals or sugary beverages that have sugar added as an ingredient. And the recommendation is absolutely none for the first 2 years. And you can probably guess, how are we doing with meeting these recommendations overall? Overall, we're not doing well. Children are consuming woefully inadequate amounts of vegetables. So if you exclude white potatoes, 40% of children consume no vegetables at all. And low in seafood, which is recommended twice a week for brain health. And kids are consuming too many refined grains like white rice and white bread and crackers and cookies and things with basically flour. And they're consuming an average of 6.5 teaspoons of sugar a day when the recommendation is 0. And the reason that sugars are just so recommended for avoidance is because when children are so little, we know that, like this little girl you see eating, she's probably going to eat like 4 bites and she's going to be full. So every bite that they take needs to be a food that contains nutrients. Otherwise, they're not going to meet their nutrient needs for the day. We also know, and PHA has done a lot of work in this area with our Shaping Early Palates initiative, that this is a time where the taste buds are malleable. It's like a teachable moment for your mouth. And when you're introduced to vegetables early, like 10 months of age, kids are more likely to still be consuming those vegetables when they're 6 years old. Their taste buds learn what to like during this period. So it's so important that we're exposing kids to those healthier foods and less of those foods that we know are associated with poor health outcomes. So let's next look at some of on the next slide, look at the inequities. So the Feeding Infants and Toddlers study looked at this in 2016, and what they found was that Black infants were consuming significantly more of all of those foods that we said are recommended for avoidance: sugar sweetened beverages, sweetened bakery foods, few vegetables. That white children were those most likely to have colorful vegetables, seafood, nuts, seeds, whole grains. And then what does this mean? What does this actually result in our population? So it means we've laid the foundation for future intake of these foods, right? If the taste buds are teachable and this is what they've been taught, this is what persists. And we see this in the literature. So if you look at Black children who are ages 2 to 19, 73% of their calories are coming from ultra processed, that's sort of shorthand for junk foods. And this also causes the highest prevalence of untreated dental cavities in this group. And according to current estimates, most children, if you're a child today, the majority of children will have obesity by the time they're 35. And for Black and Hispanic children, most Black and Hispanic children of today will have obesity by the time they're 25. Black, Hispanic, and Indigenous children have significantly higher rates of type 2 diabetes. You remember we used to call it adult onset diabetes, but we can't call it that anymore because so many children have it. And the rates among Black, Asian, and Indigenous children are increasing for type 2 diabetes 10 times as fast as the rate for white children. So what's in the groundwater? There's a fantastic article called A Call to Action to Address the Root Causes of Racial and Ethnic Health Disparities in the March issue of the Journal of Nutrition, the Journal of the Academy of Nutrition and Dietetics. And they talk about historical practices like redlining, where the US government codified housing discrimination, which shut Black American families out of the American dream of home ownership and instead pushed those families towards urban housing projects, which robbed future generations of the wealth that home ownership allows families to build. Too many Black and brown Americans live in neighborhoods that lack green space and lack full-service grocery stores, but have way too many fast food restaurants and corner stores that are selling the very foods the dietary guideline says to avoid, and where junk food marketing is disproportionately targeted. Social science research shows families that are worried about how to make ends meet and who are experiencing working long days, maybe a day job and a night job, are more likely to choose foods that kids will eat without a struggle and where you can just do something easy because you've done so many other hard things that food sometimes ends up being the what is the easiest choice. So we know that, overall poverty changes the balance of priorities, and food may not be a battle that can be fought. When you're trying to be resourceful and figure out how to keep your lights on and keep your kids safe in a high crime neighborhood, sometimes food drops to the bottom of the list. And this brings us back to how we end up with missing this teachable moment for the taste buds. And there was actually a great article in yesterday's Washington Post about a daycare program where children were getting their taste buds tuned to a lifetime of healthy eating, and where little kids are tasting fruits and vegetables and they're rewiring. It's not irreversible. These can be rewired if kids are exposed to those foods. Next slide. USDA did some research on SNAP participants. SNAP is the new name for what was formerly known as food stamps. So they looked at what are barriers to eating healthy for people who are getting SNAP. And 88% of them did report that they have challenges to consuming a healthy diet. And the number one barrier, the most frequently reported barrier, is cost. And this is guiding PHA's work and priorities in our food equity initiatives. Next slide. I want to quickly touch on a few very important federal nutrition programs for infants and toddlers, starting with WIC, which is our nation's infant and early childhood nutrition program. Their tagline is WIC works, and that is true. There was a recent study in the American Journal of Preventive Medicine that showed that the longer children and families participate in WIC, the better children's diet quality became, and that could potentially mitigate chronic disease risk. And recently, the American Rescue Plan invested a historic $390 million to improve the reach and effectiveness of WIC. So this is a huge move forward for nutrition security. SNAP, our largest food assistance program, had recently been reevaluated in terms of the amount of money families get for food. It's called the Thrifty Food Plan, and that was increased by 21%. So that was the first permanent increase in SNAP benefits in 45 years. So these are great strides to food security and nutrition security. And we know that there's still work to be done. So next slide, and I'll talk a little bit about PHA's approach to food equity. So on the next slide, our 3 pillars for food equity are a healthy food supply in the public, private sector, and the charitable food system. The families have access to affordable, good food in all communities, and that families know how to prepare a healthy, quick meal on a budget. So they have the awareness, knowledge, and skills to do that. Next slide. So I could talk for another 30 minutes about everything that we're doing at PHA, but I'll talk briefly through a few of these. So our Veggies Early and Often, Shaping Early Palates initiative is increasing the veggie forward product offerings in the baby food marketplace at all price points to build up a generation of veggie lovers. So we're capitalizing on the malleability of young taste buds to develop curiosity and adventurous way of eating that includes vegetables. Through Good Food for All and Pass the Love, we're providing families with fresh produce and healthy meal kits to spur changes in the retail sector and also to build up lasting, healthy habits for families. In our Healthy Hunger Relief initiative, we're partnering with food banks across the country to help them improve the nutritional content of their inventory. And last but not least, we're also working on regional food system transformation projects. And we're starting our work in the Mississippi Delta to strengthen the regional food system by uplifting Black farmers and foods of the Delta while also driving demand for healthy local food among young adults with children. Next slide. So I invite you all to join us to support our work by signing our Food Equity Pledge, signing up for our newsletter, email us, partner with us. I also invite you to save the date for our PHA Summit on May 18th. It will be virtual this year. We'll have some very exciting speakers lined up, including Dr. Sarah Bleis, who will be talking in a few minutes and who's a friend and colleague that I think you'll be excited to hear from, as well as many other speakers. So next slide. So in closing, whether you're working at the level of the fish, the lake, or the groundwater, we all need to keep working. And if you're inspired to reach beyond the level where you've been working, we need to do it. We all need to be looking at and examining and working in all of these areas if we're going to have an impact on food security and nutrition equity. Thank you.
Awesome. Thank you so much, Dr. Marotta. I really appreciate your remarks this morning. And if You'll be able to hang around. We will go to the question and answer after our next speaker, Dr. Tanya Eggers-Collins, who is a program director in the Health Behaviors Research Branch of the National Cancer Institute, and she's going to talk to us about NIH's Nutrition and Health Disparities Framework. So take it away, Dr. Eggers-Collins.
So good morning, everyone. I'd like to thank USDA for the opportunity to present on the NIH Nutrition and Health Disparities Framework. And I'm presenting this on behalf of the Nutrition and Health Disparities Implementation Working Group. So good morning. Next slide, please. So as nutritionists, we all know that diet is a very important modifiable risk factor, and a healthy diet can improve health and reduce chronic disease. Next slide. So I like to highlight a study that was taken from the Atherosclerosis Risk and Community Study. What they wanted to do was to look at two indices, one focused on the Healthy Eating Index 2015 and the Alternative Healthy Eating Index 2010. And what they wanted to do is determine whether or not a healthy diet could prevent cardiovascular disease. And so what they found in this study, there were some differences between the indices, but what they found was that both indices, a high diet score was associated with a reduction in cardiovascular risk or disease and prevention of that, and specifically as it relates to CVD and heart failure. Next slide, please. This next slide estimates the cancer burden attributable to suboptimal diet among U.S. adults in 2015. The first figure to the left highlights dietary factors in the cancer burden, and they found that insufficient whole grain intake accounted for a large percentage and portion, as well as a number of cancer cases, followed by insufficient low total dairy products, as well as high processed meats and vegetables and fruits. Also, in addition to that, if you take a look at, and a large number of the cancer cases was associated with colorectal cancer risk. To the left, we have the usual suspects as it relates to socioeconomic status, as well as race and ethnic factors that are related to the cancer burden. In addition to that, I just wanted to highlight a few things, the usual suspects such as health, related income, education, race and ethnicity. And so what they found was that non-Hispanic Blacks and Hispanics had a larger proportion of the cancer burden, and particularly as it relates to a reduction or insufficient intake of whole grains. Next slide. So we know as nutritionists that a poor diet or inadequate diet is associated with a number of adverse outcomes such as obesity, diabetes, cardiovascular disease, as well as diet-related cancers. And we know that there are disparities as it relates to poor diet quality related to socioeconomic status, race and ethnicity, and a number of other factors. Also, we know that poor diet is associated with increased risk for morbidity and mortality. Also, I like to highlight that food and nutrition insecurity has also been linked to poor diet quality and nutrition-related health disparities among those who are socially economically disadvantaged. Next slide. So this slide highlights cardiometabolic health outcomes among adults and the AdHealth study. The AdHealth study is the national longitudinal study of adolescents to adult health. And what they did was they looked at the risk of food insecurity by cardiometabolic health and those who were not at risk for food insecurity. And as you can see, BMI and the prevalence of obesity at both wave 4 and 5 were associated with a higher number of participants who were at risk of food insecurity. If you take a look at wave 5, we also see that the prevalence of diabetes at wave 5 was higher among those who were at risk of food insecurity compared to those who were not at risk. And further analysis actually showed that The risk of food insecurity in young adulthood, young adulthood was in wave 4, was associated with increased incidence of diabetes, and middle adulthood, which is in wave 5. And this significance and association still persisted even after controlling for BMI and socioeconomic status. Next slide, please. So I'd like to turn my attention now to the NIH Nutrition Strategic Plan for Nutrition Research. The strategic plan was implemented in 2020. It was published in 2020, and it's a 10-year plan, and it's centered around 4 major goals that focus on precision medicine approaches. One is to spur discovery and innovation through foundation research, to investigate the role of dietary patterns and behaviors for optimal health, to define the role of nutrition across the lifespan for healthy development and aging, and to reduce the burden of disease in clinical settings. So there are a total of 7 implementation working groups, and I'd like to highlight just one implementation working group, which is the Nutrition and Health Disparities. This implementation working group works with the other implementation working groups to support nutrition-related health disparities research, because nutrition and health disparities is a cross-cutting theme, and it impacts all of the implementation groups. Now, as a result of the Nutrition and Health Disparities Implementation Working Group working with the other working groups, we developed the Nutrition and Health Disparities Framework as a way to show that nutrition and health disparities cuts across the entire life cycle. Next slide, please. So the Nutrition and Health Disparities Framework addresses really the dynamic interplay of multiple levels of influences. It operates between biological, behavioral, environmental, and healthcare domains. And it cuts across the socio-ecological model at the various levels, such as individual, interpersonal, community, and societal levels. And the purpose of us developing this framework is to show that, not only do you want to work at the individual level, that you have to focus on a number of different factors that influence health disparities, because we know that there are multiple determinants of health disparities and multiple determinants of food intake as it relates to dietary intake, nutritional status, and health. So it posits that we need to work more than just at one level, but multiple levels. Next slide. So this is the framework that we developed. It's developed or adapted based on the National Institute of Minority Health and Health Disparities. So they have a framework, and their framework has the levels of influence, which is on the x-axis, where you focus on individual, interpersonal, community, and societal levels. And then on the y-axis, you have the domains of influence, the biological, the behavioral, physical and built environment, and the sociocultural environment and the healthcare system. So we adapted their framework and we made it more nutrition-centric, where we can focus on many of those levels of influence that may influence nutrition intake, as well as food intake, a number of different factors that can increase risk for health disparities. Next slide. So what I would like to do now is to provide some examples of the framework at different life stages, looking at equity and cultural diversity. Next slide. Okay, so this is an example. We have the life cycle, we have levels and domains, and we have outcomes. And even though I have arrows that are going linearly, it's linearly looking at one level to the next level to outcomes, there's also synergistic interactions that we have to take into consideration as well. So at prenatal and birth and infancy, at the individual level and at the built environment level, you may have a lack of full service grocery stores in some neighborhoods, limiting intake of fruits and vegetables or other important nutrients that one must have during pregnancy and post-pregnancy. In addition to that, at the community and healthcare system level, there may be a lack of safety net nutrition services such as the WIC program. And these levels and various domains may interact and influence outcomes such as maternal nutrient deficiency and high risk of prenatal birth weight. For children at the interpersonal and behavioral level, there may be family or peer norms related to breastfeeding and early childhood nutrition. And there may be interactions with the societal and healthcare system levels and domains where there's poor resource food environments, such as a lack of preventative health care, which can increase risk for childhood malnutrition and insecurity. In addition to that, another example could be the interpersonal and social cultural levels, where you have family cultural backgrounds and diversity related to food choices and preferences may influence childhood risk for malnutrition, as well as at the societal level where there's poor uptake of federal nutrition programs. And that can also increase risk for food insecurity and malnutrition as well. Next slide. Now, going through the life cycle, now we're going to focus on families and older adults. So at the societal level and social cultural environment level, we have the potential of possibly job discrimination or job loss, which can impact income, housing, as also racial segregation as far as neighborhoods. And that could be that interact with a number of other factors such as interpersonal and healthcare system, where there's a lack of trust in the patient-clinician relationship, which can affect poor diet quality and risk for diet-related chronic diseases and increased mortality from many of these chronic diseases. As it relates to older adults, at the level individual and the domain of the biology, there may be genetic predispositions, for example, increased risk for hypertension, which means that individuals should watch their sodium intake. And that could interact with the built environment as well as community, where if one lives in an environment where there are food deserts and corner stores that offer a number of snack foods that are high in sodium and high in fat. In addition to that, at the societal level, where food marketing policies that target low-income neighborhoods that focus on targeting nutrient-poor and energy-dense foods. So the consumption of one's individual at the biology level and the built environment and the interaction could cause individuals to consume high intakes of unhealthy foods and increase risk for chronic diseases. Next slide. So we feel that these are just examples of the framework that I'm providing. You can go to the Office of Nutrition Research website to take a look at the framework and to provide recommendations or suggestions or comments on that framework. And Jamie has that link that she can share with those who are listening today to this webinar series. In addition to that, we want to say that the framework should be used by a number of practitioners, such as nutritionists, public health educators, researchers. We feel that this framework can help to encourage researchers or individuals to try to understand health disparities by looking at a number of multi-level approaches and multi-domain aspects of this framework and how that can decrease risk. Also, we feel that this framework provides a better understanding of those interrelationships that could lead to the development of nutrition interventions to reduce health disparities and to promote health equity. Next slide. So I'd like to thank my co-chair, Allison Brown, who is the co-chair of the Nutrition Health Disparities Implementation Working Group, as well as all of the Implementation Working Group members who have been working tirelessly on the framework, but not only the framework, on developing a NOCI and other. We had a food insecurity workshop last September. So we have a number of different projects that are ongoing. So I'd like to acknowledge everyone that's involved in the Health Disparities Implementation Working Group. So I'd like to stop there and address any questions that you may have.
Outstanding. Thank you so much, Dr. Akers-Collins. I really appreciate the presentation this morning. We have a little bit of time for some questions that I have here. One that I want to ask for Dr. Moroto is, can you talk a little bit about the intersection between inflation and nutrition security, and what can be done about it? And we only have a little bit of time.
That's an excellent question. And in short, that, you know, anytime there is an emergency, there's a pandemic, there's economic inflation, those who have least resources are going to experience that in a more intense way. So absolutely, that's having an impact on nutrition security. And, you know, at PHA, we're looking at entrepreneurial solutions like meal kits that compete on price with fast food. If you look at the most popular meal kits, you're looking at $10, $12, $15 a serving, where we're working on some that are $4 a serving. So bringing these things to market with an entrepreneurial lens is where we're focused. But then outside of that, making use of the federal nutrition programs, as Dr. Eggers-Collins said, a lot of people are not necessarily even enrolled and they may be eligible. And then as a former FDA and USDA employee, I have to put in a plug for MyPlate resources like Shop Simple with MyPlate, which gives people tips on how to make the most of their food dollar. So those are some of the remarks I have with regard to inflation.
Awesome. Thank you very much. Let's see here. So a question for Dr. Eggers-Collins. What parts of the framework do you think can be quickly implemented or more easily implemented?
So I think it depends upon whether or not you're a researcher or what aspect of the life cycle that you want to focus on. I think some individuals are interested in policy and how policy influences, nutrition intake and health disparities. So they may want to work in that space. Others may be working at the individual level, but they want to understand how these other structural factors can influence intake and health disparities. So I think it just depends upon the lens of where you're coming from and what aspect that you feel most comfortable in tackling.
Excellent, thank you. One of the things I wanted to point out, we talk a lot about precision agriculture and the data issues related to that here at the National Ag Library, and the growing importance and prevalence of precision nutrition and its intersection with food insecurity was really intriguing to me as well. And I know we're running a little bit out of time, but I was interested in kind of marrying up Dr. Moroto's answer about the packaged foods, the food system, the package systems with that precision nutrition, and if there's any kind of areas for synergy and that sort of thing in those two areas. I don't know if either one of you want to take a shot at that. I guess I'm the moderator, so I should call on somebody. Dr. Moroto, would you like to go first?
Sure. So the question is how to marry up precision nutrition with sort of entrepreneurial solutions. I think that's a wonderful idea. And we're exploring models where people can have more choice in terms of what they're eating and where it's tailored to the specific individual. But I think that's where the market is going and where we would like to be eventually.
Excellent. Thank you. Dr. Eggers-Collins, would you like to comment on that?
Well, I think that's a tough question for me, being a researcher at NIH. We don't get too involved in entrepreneurial situations, but I think maybe someone could use the nutrition and health disparities framework to maybe advocate for healthier snacks or healthier food options at the policy level. And that in turn can move the entrepreneurial side where people are making healthier snacks and, providing more options at many of these fast food restaurants. So there are a number of different ways you can approach it, but I think that, policy really makes a difference as it relates to providing the entrepreneurial side as far as influencing consumption and intake and the quality of foods that are offered.
Excellent. Thank you very much. And thank you both for your presentations and the questions and answers this morning. I really appreciate that. And I encourage people to go down to the reaction button and clap. I know our tech folks will probably go bananas when we try this, but thank you for your presentations as we transition into our next speaker. And I would like to introduce Dr. Sarah Bleis from the USDA. Dr. Bleis was recently named the Director of Nutrition Security and Health Equity for USDA's Food and Nutrition Service. She's going to give an overview of USDA Secretary Vilsack's goals around nutrition security. And as a reminder, she will be back with us on May 10th at 1 p.m. to talk about nutrition security definitions and discussions in a more fulsome presentation. And as a point of personal privilege, I want to say thank you to Dr. Bleis for her outstanding leadership and insights and help with the COVID-19 transition here at USDA. And I've really appreciated all the presentations you've done for the staff and the leadership here at ARS and across the department. So thank you very much, Dr. Bleis. And I will turn it over to you and Dr. Fleischhacker.
Thank you, sir. I very much appreciate that warm welcome and do miss the COVID side of the house, although I'm very happy to be on the nutrition side. Good morning, everyone. As Paul said, I'm Sarah Bleis. I am the relatively new Director of Nutrition Security and Health Equity in the Food Nutrition Service, or FNS, and do want to first start by saying a big thanks to Maya for the very kind shout out earlier in the meeting. And I have to share a fun fact about me and Maya, which is that we went to grammar school in Baltimore City together. So greatly appreciate her work with the Partnership for Healthier America to address equity, nutrition, and food security. I also want to underscore the importance of Dr. Agers-Collins' leadership at NIH on food, nutrition, and security, and her coverage today of the root causes of nutrition health disparities. This two-part event is jam-packed with great speakers and thought-provoking content, and I'm really excited to see the outcome of your Wikipedia editing. So before jumping in, I do want to mention last week's historic and I would say inspiring address by Secretary Vilsack on nutrition security. I hope you were all able to make it. If not, the conference hosts will share links to his address. We also had a report outlining USDA's actions on nutrition security, and there's also an accompanying infographic, which sort of tries to boil it all down into one page. And then the final part of the comms piece is nutrition security web pages, one overall page, and then one for each of the pillars that we're going to talk about today. So I hope you have a chance to listen if you haven't already. I hope that you can review the documents and would welcome you to be in touch with ideas about how we can further our efforts to promote and elevate nutrition security. And once you have the wiki page up, we would very much appreciate your help disseminating and generally through your networks as it makes sense. So as Paul said, what I want to do today is share two things. First, I want to briefly explain the intersection between nutrition security and health equity, building on what Dr. Moroto said, including some definitions that we view as foundational to the work ahead. And then I'll give you an overview of our nutrition security report that was released at last week's event. So while you have been hearing, I'm sure, the term nutrition security a lot over the past year, what's become increasingly clear to us, and I suspect to some of you, is that if you asked 5 different people what nutrition security means, you might get 5 different answers. So at USDA, one of the things that we've been trying to accomplish over the past month, as March is National Nutrition Month, is trying to get everyone speaking the same language when it comes to nutrition security. And so one reason why it's so great to have an opportunity to speak with all of you is that you've got a great ability to reach participants in the Federal Nutrition Safety Net, among other key stakeholders. And you've got digital mediums that we think will make you invaluable ambassadors to help push this messaging out. So do just want to be sure to thank you in advance. So let's turn to the concept of nutrition security. What it aims to do is to better recognize the coexistence of food insecurity and diet-related diseases and disparities. So nutrition security means having consistent access, availability, and affordability of foods and beverages that promote well-being and prevent disease, and in some cases, treat disease. And this is particularly true among racial ethnic minority populations, lower income populations, and rural and remote populations, including tribal communities. Now, we'll say, particularly to this audience, that nutrition security is an emerging concept, and it builds on long-standing efforts to address food insecurity among all Americans. but it's distinct in two ways that I really want to foot stomp on. One is that it recognizes that we are not all maintaining an active and healthy life consistent with federal recommendations. And the second is that it emphasizes taking an equity lens to our efforts to ensure that access, availability, and affordability to foods and beverages is happening among populations who are often managing both food insecurity and diet-related chronic diseases. So to put it most simply, you can think of nutrition security as having consistent and equitable access to healthy, safe, and affordable food. Now, the other term that I want to make sure that we're on the same page about is health equity. So health equity refers to everyone having an equal opportunity to live the healthiest life possible, no matter who they are, where they live, or how much money they make. Now, many of you have worked, I'm sure, in the food nutrition space for a long time. And you might reasonably be wondering why the Secretary is so passionately focused on nutrition security now, as we can probably agree that there have been efforts to strengthen the public health impacts of the federal nutrition safety net over the past few decades, and those have been increasing. So the answer of why now largely lies with the pandemic and our administration's goals to advance racial equity. So as you heard from speakers earlier today, one of the things that COVID-19 did is it brought health disparities and the vital need for access to healthy food right up to the forefront. There's one study that estimated that nearly 2/3 of COVID-19 hospitalizations in the US were related to 4 diet-related diseases: obesity, diabetes, hypertension, and heart failure. And disparities in diet-related diseases like these are associated with decades of structural limitations to retail food outlets that sell healthier foods. And these disparities are also rooted in other long-standing historical inequities. So to try to make this more concrete, let's think about 2 examples. One is the morbidity and mortality disparities that Black mothers face, which are among the highest in the developed world, and driven in part by factors like limited access to quality maternal care and relatively lower rates of health insurance. Another is access to quality food, which is a much larger problem in poor minority neighborhoods. And besides retail food access challenges, accessing healthy food during the pandemic was also challenged by school closures, which halted our ability to serve school meals in the traditional way. Now, I'm guessing that we can all agree that addressing racial inequities will be challenging work, but it will ultimately be the most effective way to ensure that we all live the healthiest life possible. So I'm really looking forward to working with each of you on promoting and elevating nutrition security and advancing racial equity. So let's turn now and think about the key equities that USDA brings to bear that make us uniquely qualified to lead the federal government on nutrition security. And there are 4 main ones that I want to leave you with. The first and perhaps most obvious is our nutrition assistance programs, which, as I'm sure you know, reach tens of millions of Americans, including more than 30 million children each school day and nearly half of all infants in the United States. The second is our nutrition education and promotion efforts, which total more than $1 billion per year across all of our programs, with the largest being SNAP-Ed and WIC nutrition counseling. The third is by translating the dietary guidelines for Americans through MyPlate and broader investment in research and food systems. And then the fourth is other complementary activities across the department, such as GusNIP and FNEP. So to guide us toward nutrition security, we have spent the last several months identifying 4 pillars, which serve as architecture around all the work that we're doing. There's so much going on that we're proud of, but the challenge has been to really describe it coherently, which is what the framework that is presented in the report and what the Secretary announced last week attempts to do. We also hope that this can help you see how your work fits in with what USDA is already doing, and then help us identify gaps and pinpoint where we can do more. So we'll be, as you heard, we'll be presenting more in depth for this series in May and a bit more about our 4 pillars. So I'm just going to run through them briefly, and we'll just flag that on the new website, which is usda.gov/nutrition-security, you can find all this information. So the first pillar is providing meaningful nutrition support from pregnancy to birth and beyond. The second pillar is connecting all Americans with healthy, safe, affordable food sources. The third is developing, translating, and enacting nutrition science through partnership. And the fourth pillar is prioritizing equity every step of the way. Now, under each of those pillars, we've identified subcomponents which spell out in a bit more detail some of the activities that we're doing. So if we turn to meaningful support first, you can see that it has 4 subpillars. If you look at that first one there, ensuring benefits are adequate to support healthy eating patterns, one key example there is going to be the reevaluation of the Thrifty Food Plan, which happened in the fall of last year and increased the monthly benefit by about 21%, which essentially is helping put healthy food within reach. For the next pillar, healthy food, we've identified 3 sub-pillars. And you can see that one of the things here is promoting fruit and vegetable consumption, which is exemplified by the WIC cash value benefit, which increased the amount of money that moms and eligible children get for fresh fruits and vegetables through the program. The third pillar is collaborative action, which has 4 pieces under it. And here a key one to highlight, and Dr. Maroto mentioned this, is the DGAs and the important role that they play in getting information to consumers, particularly through the translation of the DGAs into MyPlate. And the fourth one that you can see here is equitable systems, which has 5 different pieces. And one thing to really stress and underline under equitable systems is the work that we're doing around the expansion of online shopping for WIC and also for SNAP Online. Through the pandemic, as I think you well know, there was a big increase in the ability of participants to use their SNAP benefits online, and we are now at, I believe, 47 states and the District of Columbia. So there's been a lot of expansion there in SNAP and more to come for WIC Online. Also just want to say, and this is included in the website and the infographic, that we have a lot of significant efforts underway that are pointing toward advancing nutrition security efforts for tens of millions of Americans. So this includes things like finalizing our historic update to the Thrifty Food Plan, which we just talked about a few minutes ago. And that's going to be by issuing the updates for Hawaii and Alaska. We are updating the WIC food package with science-informed changes. We are updating the school meal standards while seeking support and incenting school food operators to pursue changes even more aggressively. We're launching tribally led nutrition initiatives. We're initiating the next edition of the Dietary Guidelines for Americans, and we're restructuring SNAP-Ed. I do want to emphasize throughout all this work, we are driven by research and grounded in science. It is very clearly woven into our policies. It informs each of our decisions. And most importantly, it impacts every life we touch. And personally, as someone who as a child was a WIC recipient, my family also used food stamps for a period, now SNAP, and I definitely ate school lunch. I definitely appreciate these programs from a personal standpoint and very much from a professional standpoint. So let me just wrap by leaving you with 3 concluding thoughts before you transition to the Wikipedia editing. The first is that now is really the time to lean in, since food insecurity and diet-related diseases are high and diet-related diseases are rising due to the pandemic. And then both these things, food insecurity and diet-related diseases, disproportionately impact historically underserved populations. The second is that nutrition education and promotion plays an invaluable role in our department's ability to not just provide all Americans access to safe, nutritious, and affordable food, but also to help them understand how to prepare it on a limited budget, and then facilitate consumption across a range of life stages and food preferences. And I'll say personally that I've got 2 young-ish girls, 8 and 10, and I find that these tips for promoting healthy eating are super helpful for just trying to get them excited about eating healthy food in a positive way. And last but not least, we cannot do this alone. So in addition to leveraging USDA equities, we will need to effectively and efficiently engage and collaborate with external partners. So we look to lift up what has worked and then create and enhance additional promising opportunities, and look forward to the possibility of working with each of you. So in closing, I hope that I provided some food for thought for how important accurate information like Wiki is, and we aim to promote and elevate nutrition security. So let me stop here. Happy to answer a few questions if there's time, but regardless, really appreciate your attention. Thanks.
Thanks so much, Dr. Bleis. We're very excited you were able to be with us today and give us a lot of resources to work with for the editing event that we'll have afterwards. I don't see any questions in the chat, and we're running close on the time, and you'll be back on May 10th at 1 p.m. So We'll make it happen then. And again, thanks so much for your participation today. We really appreciate it. And we're very excited about all the great work that we're going to be a part of here at NAL, working with FNS and then with all of our stakeholders and partners, many of whom are on the call today. So thank you very much.
Thank you, sir. Appreciate you having me.
Thank you. All right. Our last speaker today is Leilani Nelson, again, the Associate Director of the Center for Agriculture and Food Systems at the Vermont Law School. Again, one of our Ag Law Information Partnership partners. And she is going to talk about the center's Healthy Food Policy Project. So take it away, Leilani.
Thanks, Paul. And thank you to Dr. Maroto, Dr. Ager-Collins, and Dr. Bleis. I learned so much from your presentations, and it's a privilege for me to be here to speak as part of this event with you all. So again, my name is Leilani Nelson. I'm the Associate Director and Research Fellow at the Center for Agriculture and Food Systems based at Vermont Law School. And I'm just going to share some policy tools to increase access to healthy food with you all today for a few minutes. Jamie, you can hit the next slide, please. Okay, so at CAFS, we develop law and policy tools to create a more sustainable and just food system. And we train students being at a law school. So that is our mission. You can click the next slide, Jamie. So we do this by taking a food systems perspective. And we partner with USDA, NAL, National Ag Library, and with a wide range of other organizations to develop these legal tools and resources for a wide range of audiences, from farmers to distributors, consumers, policymakers, and more. And you can see here a few examples of our projects that display this wide range of work. So for example, we created a farmland access legal toolkit to help farmers and landowners affordably access, transfer, and conserve farmland. Our Extension Legal Services Initiative has a series of fact sheets that answer common questions that farmers may have about Federal Food Safety Modernization Act. And for example, our Farmers Market Legal Toolkit has legal resources, best practice recommendations, risk management tools, and information about implementing SNAP EBT at farmers markets for farmers market managers and leaders. Next slide, Jamie. And the Healthy Food Policy Project, which I'll talk a little bit more about today, looks at how local laws and policies can increase access to healthy food. And our Gleaning Project has resources for organizations across the US that are working to reduce food waste and food insecurity in their communities. Next slide, Jamie, thank you. So the Healthy Food Policy Project identifies and elevates local laws that seek to promote access to healthy food while also contributing to strong local economies, an improved environment, and health equity, with a focus on socially disadvantaged and marginalized groups. And this project has been a collaboration between CAFS and the Public Health Law Center, as well as the Red Center for Food Policy and Health at UConn. And with all of our work at CAFS, we take a food systems perspective. So we look at that for increasing access to healthy food, which means identifying laws and policies spanning from food production. So policies that might create incentives or tax credits for farmers, or policies that clarify where urban agriculture is allowed in land use planning and zoning, all the way to policies that address food processing, distribution, consumption, and surplus and waste management. And on our Healthy Food Policy Project website, you'll find a policy database with over 400 local laws. And we have some case studies, short reports, and policy tools. And today I'm going to just highlight a few of those with you. Next slide, Jamie. Thank you. So what do we mean by healthy food? And I know a lot of the speakers have shared a lot of definitions today, so I figured I would share this, which is the definition we use for this project. So for us, healthy food means food that is minimally processed, fresh, frozen, or canned produce that has little, if any, added sugar, salt, or fat, food that is culturally relevant, food that meets evidence-based nutrition standards, and food that is both nutritious and safe to eat. Next slide, please. Thanks, Jamie. All right, so this just gives you an example of our policy database. I thought we could do an exercise together here. So if you want to use this policy database, you can either use keywords such as community garden, which I threw in here. You can also search by the stages of the food system, by jurisdiction, type, population size, or whether or not the policy refers to a priority population. And I used community garden and found some interesting policies. I selected the one from Lauderhill, Florida. Next slide, Jamie. And so for each policy, you'll find this policy record page, which has a summary of it and other basic information about the laws. And you can link to the actual law itself, clicking view law, if you're interested in seeing the language in the law. Next slide, please. And I wanted to highlight that some of the policies in our database correspond to certain diet-related strategies that are identified by the County Health Rankings What Works for Health tool. And for these specific policies, we've added a link to the What Works for Health tool so that you can see if there is scientific evidence for the effectiveness of the policies that you're looking at. So for example, this policy from Lauderhill links to the evidence for community gardens and also urban agriculture. And it shows you a little rating. That's the green bars there at the top. So this shows there's some evidence for the effectiveness of this policies that support community gardens like this. And it also shows you some expected outcomes. So I encourage you to check those out. And generally, our hope is that by providing easy access to these types of local laws, that it will inspire communities across the country in their own policy efforts. And I just want to note, we also have a COVID-19 policy index on our website that shows specific policies that increase access to healthy foods during emergencies such as COVID. All right, next slide, Jamie. We also have additional resources that go deeper into the policy development process, such as case studies, and also a policy drafting guide, which identifies some important considerations when drafting local policies and gives you some common elements of the law, from the findings, the purpose, definitions, main provisions, exceptions, etc., for those that aren't familiar with those. And this resource also emphasizes that policies need to be designed to reduce racial and health inequities and improve health for all, which requires intentional decision-making and thinking about how the policy may impact health outcomes for Black people, Indigenous people, and all people of color. And it also requires working with community members and embracing their knowledge, capacity, and experience through authentic resident engagement. And I'm going to talk a little bit more about that. Next slide, Jamie. Thank you. So this is a resource we've recently developed about authentic resident engagement, which we define as an inclusive process for informing, designing, implementing, and evaluating food access policy changes that centers communities' residents. So it requires an intentional commitment to address power imbalances and overcome historical and ongoing barriers to inclusion, such as the law, policy, and systems that intentionally exclude Black, Indigenous, and people of color, while supporting and looking to those most affected by the inequities to lead the process. Next slide, please. And I wanted to share this spectrum, which you can find in our tool, and we pulled it from this awesome, great resource that I've linked there for you. And it can be used by local governments, nonprofits, and community groups to facilitate community participation in solutions development and decision-making. And I wish I had more time to talk more about this, but I figured I could highlight a few of these resources. But I encourage you to check out the Healthy Food Policy Project website for more information on this project. All right, Jamie, next slide. The last project I want to share with you is our Farm to School Policy Handbook. This was developed in partnership with the National Farm to School Network, and it highlights state level policies that support farm to school through school gardens, food and ag education, and also local food procurement. And so in this handbook, you'll find summaries of bills and resolutions introduced between 2002 and 2020 from 50 states, District of Columbia, and US territories. And it builds off of a resource that we previously called the State Farm to School Legislative Survey. And we update this about every 2 years. And you can find the bills listed by their jurisdiction, so by the different states or territories, but also by the different topics or categories. It's not an online database, but it's a PDF that's easy to kind of click and search between the different sections. And we also have 3 case studies that are part of this handbook. One is on local procurement incentive programs. The other is on key strategies to support native food and tribal sovereignty through farm to school policy. And the last one is on the COVID-19 impacts on farm to school. And I will also add that the most recent version of this handbook that we just released in 2020 also highlights legislation that could advance racial equity, such as bills that focus on food procurement practices, targeted farm to school training, and resources for BIPOC farmers. Next slide, please. Thanks, Jamie. This diagram shows kind of a range of the different types of policies that we categorize into 3 buckets. So farm to school legislation requires varying levels of political support and advocacy to pass successfully, depending on what the legislation seeks to do. For example, does it just want to generate farm to school awareness and promotion, or does it want to pass something that has reimbursement for schools purchasing local food? And the existing social, fiscal, and political factors in that state also kind of changes how difficult it may be to pass. And the bills here under the seeding category, for example, don't require funding, whereas the bills in the sustaining category include funding and may require more effort, political support, and advocacy to pass. Next slide, please. So farm to school advocates view universal meals as a strategy for advancing farm to school goals because it increases the resources that are available to school food service authorities to serve healthier meals. For those of you that may not know, universal meals means that all students enrolled in public and participating private schools in a state would receive free meals regardless of income-based eligibility in the federal meals program. And in the 2019 and 2020 legislative cycles, there were 9 universal meal bills that were introduced, including 2 that had local procurement component to it, and those are in California. And in the summer of 2021, California and Maine became the first states to adopt universal meals, providing free breakfast and lunch to all K through 12 students. There's also one in Vermont that's right now people are working on, which is exciting. And this is an area that's getting a lot of attention, is emerging opportunity that I wanted you all to be aware of. Another opportunity is that farm to school advocates are recognizing the importance of policies that support small agricultural producers and farmers in their states and regions selling to schools. And in some case, farm to school producers support policies can include, or we've seen them beginning to include, procurement preferences for socially disadvantaged small and mid-sized producers, such as a bill in California and one in Minnesota. And we're hoping to continue to see legislation that embeds racial equity in school food procurement preferences, as well as land capital and infrastructure access measures that support BIPOC farmers. Next slide. That's all I have for you today. You can get in touch with CAFS. You can follow us at CAFS Center for Twitter and social media. You can visit our website or email us to be in touch, but we'd love to hear from you. And just want to say thanks again for allowing us to speak during this event today. Are there any questions?
All right, thanks so much, Lilana. We really appreciate your presentation and all the resources you brought to bear with us today. And thanks again to all of our other presenters, some of whom are still on the line. And also want to give another huge shout out to our Ag Law Information Partnership colleagues, both at Vermont and at the National Agricultural Law Center. It's just been great to work with both institutions to advance our really important work in agricultural law. So thank you. Are there any more? I've got one or two questions I have from earlier, which I can ask. And one of them is for Dr. Moroto. If you could, if you're still on, I think you are still on, there you are. Could you talk a little bit about whether or not you're finding families are gaining access to foods at healthy foods at local food banks during the pandemic? If you could talk a little bit about that particular challenge and whether it's getting better or worsening, or what needs to be done in that area.
Let me unmute myself. Sure. So PHA is doing a lot of work in this area through our Healthy Hunger Relief Program, where we're partnered with 59 food banks across 27 states that reaches almost 15 million people. And all of those food banks are committed to evaluating the nutritional content of their food, and that equates to 869 million pounds of food. So we are working hard to make that food supply much healthier in the charitable system and have made great strides during the pandemic. So we hope that this is making a difference in terms of the inventory that people are encountering at those food pantries and food banks, because we know they're in very, very high demand during the pandemic and also with the inflation rates that we're seeing right now.
Thank you. We have a question in the chat. Has organically produced food been recognized as more healthy than non-organically produced food? And I suspect the answer to that is a 30-minute answer. So,
well, I'm not really prepared to weigh in on that, and so I don't know if other folks want to jump into that question.
okay.
I don't know if I can necessarily answer it, but I'd wonder what you mean by healthy necessarily. Organic food that's like USDA organic has to follow certain agricultural practices. And one resource that I don't know if this will answer your question, but we have a website that's labelsunwrapped.org, where you can learn about what's like the law behind the different labels that you find on your food. So that would be one place you could learn about what the organic label may mean. Okay, from a human and nutritionally point of view, and from a sustainable agriculture point of view. Yeah, I guess the other part of your question is, has it been recognized as more healthy? And I don't know at what level, like, of government, maybe you're wondering if it would be recognized as such. I can't really speak to that. I will say that I've seen for some schools that they are being specific in their procurement practices and want to procure more organic food. And organic food can be healthier than non-organic food, but not necessarily. If you think about it, there are small farmers that may produce food organically. It may not be actually certified organic, and that food, I would say, could be as healthy. So an organic label doesn't necessarily mean that it's healthier than non-organic. And also, I'll just say that you may know this, but there's a lot of larger organic farms that folks are not as convinced are necessarily better for the environment. The scale of production and the way that the food is raised on some organic farms may not be as environmentally friendly or sustainable, as you're saying, as some smaller ones that may use different practices. But I think we could have a whole different event talking about that. It's a great question.
Awesome. Thank you, Leilani. So again, I want to thank all of our participants who were online and presented today, and those of you who are here online asking questions, and we'll come back hopefully after the break to participate in the edit-a-thon. I want to give a great big shout out to all the NAL staff and contractors and collaborators who've worked with us today to make this program a great success. And I want to turn it over to
The USDA is an equal opportunity provider, employer, and lender.